Correct. And as promised, the guest, our doctor in-house, we claim you, sir. Dr. Colin Karaiga is in the house this morning, and we are going to be talking about male circumcision. I was wondering why you felt that this was the time to discuss this. Was there any particular reason?
I think we discuss various topics of public health interest.
Yes.
And November, we call it Movember. It's the time we discuss prostate cancer, for example,
yes,
as Dr. Paul did. And I thought that it fitting to also discuss male circumcision. And we discuss it and demystify it so that people understand what it is, why they do it, how they can do it, and all the other things.
Yeah.
So yeah, there was no particular reason. It's just that this month we decided let's focus a little bit on the men.
Yeah, I like that.
You guys take the rest of the year off.
I like that. And of course we have also the World AIDS Day coming right there. So next week we could be able to talk about that. But well, that is where the conversation is going to be going this morning. We are streaming live on YouTube, so please just stay tuned. And in case you have any questions, please use the number right on your screen, 0746-862227. That is where you can leave your question or your comment regarding what Dr. Colin is going to be talking about. Otherwise, good morning, sir.
Good morning to you, Stella. How are you?
I'm well, blessed. Good to have you back.
It's a pleasure.
How is ADDY Memorial Hospital?
Growing and growing.
Okay, amen. We love that. Now, in case you want to see Dr. Colin or Dr. Paul, or Dr. Lily and the others that we have not had on the show, please find them at ADDY Memorial Hospital. That is Kanyanya, right?
Yes, plot 1516 Bahai Road. For those who are coming from Gayaza Road, just branch of Gaz Kanyanya onto Bahai Road. It's about 150 meters from the junction. Okay. The prepuce of the penis surgically removing it.
Okay.
Yeah, and it has been practiced since time immemorial. Okay. I think we can go through the religions. I think in the Bible, you know that the Jews do it at 8 days, the Muslims as well. And then it also has cultural aspects in Uganda, for example, every, I think, leap year. We have our friends from the east, the Wagisu, doing it. We have in Kenya, I think it is the Kikuyu who also do it. And the Luhya.
There's something you've said. You've said it's surgical.
Yeah.
As far as I'm concerned, they pull and then I can raise a blood. What do you say?
That is surgery.
Really? Oh, actually, because for us, when we think about surgery, we think different sharpened tools, they are going to be realigned.
It is surgery only that it is surgery that is a cake, that is from a different time.
Yeah.
The current techniques that are available to us and technologies are far better. They control infection better, they manage pain better, and they make you're able to go about your business in the shortest time period. The recovery times are far less, and the complications, of course. Because just pulling and cutting has so many complications that can happen. Yeah.
When is the right time to do it? Because even when you talk about a short recovery period, I don't think what it looks like for a child will be the same it looks like for the adult. So when would you say as a doctor that you would advise this would probably be the best time to do it?
That is a bit of a loaded question because it calls us to discuss certain ethics. For example, the right to choose. So if you're circumcising your baby at 8 days, you've made a choice for them, a choice that will affect them for the rest of their lives.
Right.
You understand?
Yes.
Whereas if they are doing it in adulthood after they choose, then it's their own choice and they have that thing. So, however, we do recognize that some cultures and some people, this is what has been done.
Okay.
And then we know that healing in children is usually much faster. So in other countries, actually, the babies who work in the the doctors who work in the neonatal units, and they are trained in doing it. The technique, the most current technique they use for babies is they put what they call a circumflex ring. So they insert a ring within the sheath, and then they tie it off at the base.
Okay.
And then the prepuce just dies away, and it is done. Yeah. So usually they will do it maybe the second, third day after being born, and by the time the baby is being discharged or coming for their first immunization, they are okay.
That has already been done.
They are okay. However, for male circumcision, we need to discuss certain things which are important. The first thing I will say is that I will discuss why it is done.
Yes.
Especially among adults. Let's say you've chosen yourself.
As a mom, you've decided, let me leave that to my child.
Yeah, let's just say that, and why would you choose to be circumcised? First of all, circumcision, it has been shown, you have better hygiene.
Okay.
You don't have the foreskin that you have to clean very well, that you have that. So there is that part. There is the hygiene part. There is the part where you're fulfilling a certain cultural obligation, and you've decided to do it in hospital so that you do not go through the complications of what you said, just pull and cut. So
yes.
You want it professionally done. But it also helps to prevent yourself from getting, but also from spreading a number of diseases, infections. These infections include HIV. For example, circumcision has been shown to reduce the chances of HIV by between 60 to 66%. And that research was done here in Uganda, in South Africa, and in Kenya. And among populations which have a high burden of HIV, especially like usually you'll find it around the
where
lakes,
they fish from, yeah.
So that's where they were doing. And then in Kenya, I think it was done among men who regularly frequented bars and prostitutes and things like that. And the science behind that is that for HIV to attack you, it has to attach to something called a T cell.
Okay.
A T cell is like a soldier. So it attaches to the T cell, enters the T cell, and changes its DNA and starts proliferating. And because God was so wise, and he knew that the foreskin is some place which is not so clean and hygienic and likely to come into contact with a lot of infections, he put a lot of T cells there. So for an uncircumcised man, you have your T cells, the AIDS comes, they pick it up, then you're in trouble.
Right.
The circumcised man may not have that. That's why the chances are reduced.
Again, the word is may. Eh?
Yes.
We don't want you to take it for
No. I have to put something here. You need to understand that this is a reduction, and the reduction, as I've said, it's up to 66%.
Yeah.
But it is not foolproof. That don't go saying that for me I'm circumcised, now there's nothing else. I'm good to go. There's nothing else that I need to worry about. No, that is not the message that I'm giving. That's the first thing. There are other things like HPV. HPV is the virus that causes cervical cancer in women and penile cancer in men. And yes, it has been shown to have less incidence, meaning it is less among people who are circumcised, especially the Arab populations, the Jewish populations. You don't find them with a lot of these infections. So that's, I think, one of the things which drove research around that. You can have certain medical conditions. There is something called balanitis, where the tip of the penis, the head, gets an infection, and you have to have you just have to have a circumcision. There is something called paraphimosis. Paraphimosis is when the sheath retracts below the head and is unable to come back, and then it squeezes that place, and then you're in a lot of pain. Yeah, you're in a lot of pain. So then you'll have to have a circumcision. So those are the things. Yeah.
The
now
reasons why
the reasons
one
why
would
would consider
go
it.
into it.
So then I'm going to go into how is it done.
Okay.
Now, I don't know how culturally or religiously people do it, if they just cut and pull. But there are certain for us medically, first of all, it should be painless. So we will give you anesthesia.
Okay.
You will feel pricks at the base of the penis and around the penis, which will kill off the nerves that supply the area. And then surgically, the foreskin will be removed. The considerations that are made there is, of course, different people have different anatomy. So they'll try and remove just the optimal foreskin so that you have a normal erection. Now that's where the cultural religious thing becomes difficult. Because if it's just a pull and cut, if I cut too much, it means that when it heals and the boy has an erection, there is so much tension that the penis might buckle and bend like this, so they might have a permanent deformity.
Okay.
On the other hand, if I leave too much foreskin, then it means that I have done nothing. The foreskin will just keep coming back
always,
almost over the head of the penis. So they do it optimally. You just want to remove just enough so that someone can live a normal life.
Okay.
And then yes, it is not a very long procedure. Usually it takes maximum 30 minutes.
I wanted to ask about the anesthesia bit, because I don't know about you, but men can tend to be too, how should I put it? I do not know any man who would willingly put there for you to prick their thing. They're like, no. So where is the anesthesia? Where do you use injection?
No. Yes, we use an injection, but it is not injected direct, that we inject direct here where we are going to cut. No.
Where?
No, it's injected at the base.
Okay.
Yes, there's a nerve at the base, and then we go around. So the nerves which are supplying this side are now they are anesthetized. In other words, that it will be a painless procedure.
Okay, so in the moment it's painless, but once the anesthesia dies out, that's when the pain comes in.
Yes, and it's good to be honest in some of these things.
Yeah.
Now, if someone has ever been operated and they felt pain along their incision site, it's much the same. After the anesthesia wears off, you're going to feel some pain, some throbbing, but we usually manage this with painkillers.
Okay.
We give you painkillers that reduce that pain. Yeah. The other question which I'm going to preempt that many men ask us is, now what if I get an erection? And the thing which I will say is that the fastest way to have your erection die down is to feel pain. So if it comes, the pain comes, it is likely to die down. But usually we time your pain medications around times we expect that you might get, because men are actually entitled to about 8 spontaneous erections a day. So in the morning they usually...
Did you just say entitled?
Yes. If you're not getting them, there is an issue. It's an entitlement, we say in medicine. So,
okay.
So anyways, so we'll time the medicine so that around the times when you might get an erection,
you already have something.
You have some medicine to help you. Yeah.
Okay.
So that you don't get any issues. That's the first thing. The second thing is that, of course, the place is bandaged. Wound healing takes place in moist conditions. So you want it to be bandaged, you might put a little bit of Vaseline gauze, then bandage the place. The sutures that are used, the stitches, a woozy, they are absorbable. So your body naturally absorbs them in time. So there's nothing like coming back at it, remove.
Yeah, remove, clean.
No.
And then,
Yes. You're usually taught after the surgery, usually you're taught how to handle the wound. And what you should do, what you shouldn't do, things like that. The other thing which they advise you, most people within 3 to 5 days, they are back to their normal activity.
As adults?
Yes.
Wow.
I can tell you that many many of us doctors have our circumcisions in the 3rd year when we first see the procedure and see that it is not that dangerous. And many of them will have it on a Friday, and they'll be back to school and normal activities on a Monday. Even under normal circumstances, most people who want to have circumcisions, if they don't have periods of time when they can take a medical leave or something of the sort, we'll advise them, you come on a Friday. Come on a Friday, have it done on a Friday. You have Friday, you have Saturday, you have Sunday. By Monday, you can go back, not to full activity. We don't advise you now to say, for example, you've been an active gym member, you've been walking all over the place, you have a very active job, that go back immediately. No, but if your job entails sitting most of the time, then it is not going to be so.
Also, speaking about that, the outfits that they get to wear afterwards, I see most of them at home, they get to wear long things that are covering no trousers. Is there a particular position that you must keep it in once you are done with that?
Yes. Now, the outfits are done mostly for comfort.
Okay.
I'd say that, because remember, this is a place which has been covered for most of your life. And so it is now uncovered and it is sensitive. So even just something like wind blowing there, you'll feel the sensation, which will be a little bit negative. But what we usually do is we tell you that you should tuck it into the seam of your underwear, the elastic of your underwear, hold your penis there. Why? Because we know that after the circumcision, the head swells. So we want that swelling to die down. So that's why we put it in an elevated position, so that we allow the blood to flow back downwards.
Okay.
In other places, they'll tell you can use a bag of frozen peas and all sorts of things. But that is what we usually do in Uganda. And if you're able to put it there comfortably, then it means that you can put on loose-fitting wear and be able to move.
Okay.
The kanzus and other things that people wear are for their own comfort, because that is where they feel most comfortable. Yeah.
Okay. Now let's talk about one of men's biggest concerns, and that is sexual pleasure. In your own view and in your experience, the man who has more pleasure, is it the man who has circumcised, or the man who has not?
You see, that's a very, very, very subjective thing. But I'll say this. They are called corpuscles, the nerves that are responsible for pleasure in a man are found around the ring at the base of the penis. Okay. So research which has been done, not research saying that you go in someone's bedroom and say this guy is having so much fun, but anecdotal, meaning that people tell you or report after that, especially after 3 months. Most people, first of all, they might report increased sensitivity because the place is now open, and because of the increased sensitivity, they might say maybe ejaculation or comes a bit faster, especially in the first 3 months. But long term, for 99% of men, the pleasure is the same or even a little bit more than what it was before. This is what it is. Okay,
because I know that I was on a certain, listening to some Twitter, how do they call them, the Twitter space, where men were talking about this, and some came out to say, you know what, I wish I had not done it, because I feel like the pleasure then was much more than now, so it's always a big concern. But also the other thing is risks. Are there any risks, even when done in hospital, are there any risks to this thing called circumcision, male circumcision?
Yes, the risks are, any surgery has risks, and risks can come at any point. So in the immediate intra-op, while you're operating, there is a risk of bleeding, and that needs to be controlled. And remember, this is a sensitive thing, so there are parts of the body where we cannot apply the usual ways which we stop hemostasis, how we stop bleeding. So, for example, on the penis, you can't use cautery. You can't get this pencil that burns the vein and stops it. You have to use a thread and tie it off. So inside intra-op, that is one of the risks. if it is not being done by a proper person, like the other things I was telling you, where they remove too much foreskin or they remove too little foreskin,
Yes.
and then you end up with those long, you know, because there you can end up with adhesions, and then you'll have to have a revision of the circumcision. So there are those risks. For those who do it traditionally, we've seen some of them in hospital, this pull and cut, they can actually damage the head of the penis in that process. So that is a risk. That's why we advise that it should be done in the hands of somebody who is really experienced. The other risks, those are the most common risks. The other risks are not as common, okay. And usually we want, because it's a sensitive thing, me saying it here, someone can take gospel truth, but it is better you sit together and then I go through, because before you have any operation, a surgical medical operation, we have what we call informed consent. Informed consent means I tell you exactly what I'm going to do.
Yeah.
I tell you exactly what the benefits are, and I tell you exactly what the risks are.
Okay.
So that when you sign on that dotted
when
line,
you say yes,
it is
you know.
informed. It is not just consenting because I am the doctor and I have the technical knowledge and then I have just said this is what you need. No. I have informed you and I have educated you about what we are going to do.
Okay.
And you're in agreement with that. So that's what I would say.
Okay.
Yeah.
Now, I know that over and over again you've made it clear that, you know what, it could be left to a personal choice. But again, I have to ask, do you think that circumcision should be a personal or a public concern? Because oftentimes should I say it? Yeah. Okay. There's a Muslim school I pass by, and along that is this man on a daily, on mic, everyone can hear, and they're saying, you know what, you as a man, why haven't you done this? Please come, we do it for free on a daily from this time to this time, why haven't you? So do you think that a male circumcision should be a personal or a public concern?
It's both, because what eventually benefits the public. I'm sorry for being political, but yes, it is both, because we are not going to castigate those who make the decision not to have a circumcision. The only way we can encourage them is by showing them what the benefits are. Okay. So we have this thing here, I think, where people say, oh, you as a man, like, I would say it's the messaging. Why don't, instead of saying, you as a man, why haven't you circumcised? Just say, did you know that these are the benefits of circumcision? You understand? Right. So that let's approach things more from the positive angle than from the negative. The negative. I think you will get more traction with men that way. Because otherwise, when you say, you as a man, why haven't you done it? Immediately our interaction starts with me on the defensive, and then of course I'm likely to resist. I'm like, you, why do you want me to do it? There's something, you understand? So, and then of course, yeah, it's sensitive. It affects people's sexual health, and they will have, and us men, once you mention sexual health and performance and things like that, that is sensitive. It's a bit sensitive. Yeah. But overall, it's just about education and why we are doing it. And the approach that you go about doing it. Yes.
You know, when you are talking about going through the positive angle and not the negative, I was thinking about the gospel itself. Yes. You are more likely to be drawn to someone who is showing you the love of the Father than someone who is telling you about hell. Yes. Yeah, if someone is using the fear approach, you're likely to not adhere to the words they are saying and instead run to the person who is telling you how loving the Father is. So when you put it that way, I like it. Now, are there any long-term psychological effects when it comes to circumcision?
Psychological? Yes. I think you'd suffer psychological effects if there was a bad complication or a bad outcome from the surgery. Then that will, of course, result into psychological effects. So if it was done badly, if you were traumatized, if you've had a bad experience where you've had to go through maybe adhesionolysis and they have to revise the circumcision, or maybe you had a medical condition that actually required you and it got infected, all sorts of things. You will end up with a bit of a psychological thing. But
Okay.
I think that is manageable. It is manageable with the right counseling, it is manageable with the right support, and yes, it should not be what keeps someone away.
Okay. Now, as we wrap up, any last things that you would want the person who is watching us this morning to take away, especially when it comes to male circumcision? For me, one thing I've had, it's more of a personal thing. But even when Dr. Colin has not said it, I think he's siding more to the people who are doing it when they are a lot younger. He doesn't want to say it. But even when you said, I know you mentioned about how the people within medicine or medical practitioners, once they know it can be done safe, they do it at that time and they can heal within at least by 5 days. I know that Dr. Colin has not said it, but...
Okay, let me just say this. At any age, a man can be circumcised.
Okay.
And that it's only that the techniques will vary. And with the variation of techniques and variation in age, so will the healing process and likely complications also change.
Okay.
That's why I'm saying that it is very bad for me to just put it out there and just say. But then there are certain benefits which have been shown. And this is general, like what I've said, reduction in the chances of getting certain infections, just generally being cleaner, because you now do not need to worry about bathing and then washing your foreskin or stuff like that. So it has those benefits. Those ones are undisputable. It has risks like any other surgical procedure. Those ones are undisputable. Okay. It can be done at any age.
Yes.
But then we should, at whatever age you're doing it, you should do it with informed consent, and you should do it. It should be done with the right technique.
Okay.
Yeah, that's what I'm saying.
That is all we needed from you, Doctor.
Okay.
So if you are a man out there and you had any questions or concerns, hopefully we've been able to address them with this particular interview.
One last thing.
Yes, please.
The reason we call it circumcision, and in medicine we say safe male circumcision, is that there is nothing like female circumcision. Let me just mention this. When it comes to females, it is genital mutilation.
Yes.
So let there be nothing. I want to be clear. This message applies just to men. Women were made perfect in the way they were made.
Okay.
And they do not need to go through anything like circumcision. I have to mention that.
Thank you so much, because also, even us here in the title, we put male circumcision.
Yes,
like
it should be safe male circumcision. The key word there is safe.
Safe, okay.
Yes. Because we want to do it, it should be aseptic so you don't get infections. It should be the right technique so you don't have other complications. So it should be safe.
Okay.
And it has nothing to do with the female side.
Okay. Thank you, Dr. Colin there from ADDY Memorial Hospital in Kanyanya, Bahai Road. So in case of any questions, you can contact them directly. We have had various doctors come through from there, and next week we are going to be talking about AIDS. Just in relation to World AIDS Day that will be happening on the 1st of December 2025. So those are conversations for later, but for now we hope you enjoyed this. We have to go for a short break. When we return, we have a bit of sports coming up.